Hi and welcome. I'm trying to learn medicine. Today, bronchiectasis, and after we've done it, we're going to do stretching. And if you participate in the stretching, then it's at your own risk. And this is no medical advice, we're just learning and talking about an illness and internal anatomy. Bronchiectasis, that is an increase in size of a bronchi and bronchioles. These are the airways of the lungs. So we have the lungs, and through them they are going these bronchioles. I don't really understand it really. These are the airways of the lungs, if you can understand it with these words, which all people use when you have it. And I even know some pictures of the anatomy. I don't really understand it still. Maybe I'm going to show you this picture on the left, which is red. The lung resembles a tree, of which the yellow trachea windpipe is the trunk. This trunk divides into the bronchus of the main bronchi, which in turn subdivide into the twig-like bronchioles. These continue to branch until they end in clusters of minute air sacs called alveoli, which give up oxygen to tiny blood vessels and absorb carbon dioxide from them. Here a picture. Bronchiectasis, when there is an increase in size of these bronchi and bronchioles. So first there comes the trachea, from that comes the air, and then it goes into the branching bronchi, and they becoming then the finer bronchioles, and they become then the very fine alveoli. The condition may be congenital, present at birth, bronchiectasis, but is more commonly the byproduct of a disease or infection in bronchitis. For example, the area of lung tissue is reduced. What is normal lung tissue? And the bronchi become weakened and widen as a result. What of that is the area of lung tissue? And why does that cause the bronchi to become weakened and widen as a result? Whatever, that is bronchiectasis. Any infection in which the amount of air that reaches the lung is reduced is likely to cause bronchiectasis. Let's read it again. Any infection in which the amount of air that reaches the lungs is reduced is likely to cause bronchiectasis. For example, whooping cough, pneumonia, tuberculosis, as well as bronchitis are all associated with a condition called bronchiectasis. And that is that the lung tissue is reduced. What does it mean? And the bronchi become weakened and widen as a result. Sometimes the direct cause of a reduction of it's just what I heard quite a lot of times about bronchiectasis and all that already. And I still don't get an answer. And I'm reading again an article which doesn't use any more words, just the same words. So that's the reason why. I'm asking why, because I have these questions all ready to say since a long time, and now I have them again. Sometimes the direct cause of a reduction of air is physical. A growth may impinge on the airway, or more commonly the airway may become blocked by a foreign body, such as an inhaled peanut. A growth may impinge on the airway. Okay, but it can be if the cause is physical, but most of the times it is bronchitis, pneumonia, whooping cough, tuberculosis. But it can be also that there is a peanut stuck, so nut, which someone has eaten. Commonly, the infection of a bronchi is bronchiectasis. Commonly, the infection of a bronchi in bronchiectasis leads to the formation of infected pus in airways and a severe cough. The bacterial infection is normally treated by antibiotics, and the pus drained through physiotherapy. Okay, pus forms and a severe cough. And there exists when treatment with antibiotics and also physiotherapy for the pus. Now that was a part of bronchiectasis. Now I want to go a bit back and look if you find where it was written that it were the carotid arteries which are delivering the blood to the brain, and I think the jugular vein transports the vein. Now, but let's look if you can find that one part where it was written. If you were here for bronchiectasis, you can go directly to the next part. Okay, it was Bell's palsy, it was a thing of the facial nerve. Was it not? Atrial fibrillation, irregular beating of the heart. Atrial flutter, that was too often times ignited that's beating of the heart, but it wasn't executed every time. What the doctor might do, try to slow the heartbeat if it is too fast by pressure on one of the two carotid arteries in the neck. I don't say that these are the arteries delivering the blood to the neck. Okay, that means we're gonna wait for better naming of it. Now, I think we do the thing with intravenous. I think we're gonna do that. I'm gonna start the second camera. And I'm gonna save it shortly. I don't know, not more, but just a little thing. That's not about it. Intravenous is injection into the blood vessels of your arm like that. Just a little. It's not the biggest video in the world, but I wanted to have it. I'm going to stop the second camera. Just so you have the information fast. We're going to do a later better one where we explain what it is actually, how it actually works and what it is. But just a little bit. So, that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We were going to do a little stretching. If you stay here and participate in the stretching, then it's going to be honest. Legs standing on a shoulder wide apart. If you're breathing in, lifting the arms up. Then breathe out and go over to one side. Now breathe in and out the rib cage. And breathe out back into the middle. Breathe again in. And out over to the other side. Breathe in and out the rib cage. Out back into the middle. And the arms down. Now breathe in. Out one hand slides down the leg. Now one sees the abdominal exercises that the other shoulder stays down. Breathe again in. And out, and we're taking the arm over. Breathe in and out the rib cage. And breathe out back into the middle. Breathe again in. And out, and one hand slides down the leg, and the other shoulder stays down. Breathe again in. And out, we're taking one arm over. Breathe again in, out the rib cage. And breathe out back into the middle. Next exercise, the aeronautic iobiotic aeroplane. The feet are standing together, and breathe in and lift the arms up. And breathe out one hand down. Breathe in and reach. And breathe out one hand up. Again in. And out one hand down. Breathe in and reach. Out one hand up. And out one hands down. And now, our legs standing shoulder wide apart, and we're doing forward shoulder circles. Go back, up, and front, and down. Last time. And now backwards. The last time. And now breathe in, lift the shoulders up. And breathe out, let them fall down. Again, in the arms up. And out the shoulders down. Again, in the arms up. And out the shoulders down. Now the apple pucker. Breathe in, lift the arms up. And reach all this high. Pretend to take an apple, hanging high on the apple branch. To turn it a bit around. And then to pluck it. Now still. And now we shift up. Arms up to a T, breathe in. And out, shifting over to one side. Breathe again in into the middle. Out over to the other side. Again in. And out. And again in. Out over to one side. Again in. And out, we're leaning onto our knees. We're doing the buffalo fighting and saying over. Breathe again in. And out, we bring one shoulder in front. Breathe in and shoulder back. And out the other one in front. In. Out. In. Out. In. And out, and we're hanging down. And we're doing nothing else when breathing in. And out. Again in. And out over to one leg. Breathe it in. Out over to the other leg. Breathe it in. Out into the middle. Breathe it in. And out, coming slowly back up, making it to the backwards. Shoulder. Normal garland pose. The toes opening to the outside, having an overlapping space between the heels. We're breathing in the arms up. And now breathe out and sink down and place the elbows against the inside of the knees. And breathe in and straighten up the back. And breathe out and cover the back up. Breathe in. And out again. Again in. And out again up. Again in. And again out. And now breathe in. And breathe out and come slowly up in one straight line. And afterward we're going to continue with the next exercise, which will be the seahorse pose. And at that time I'm going to look for the bronchiectasis. And here what we had an anatomy of the lung with the trunk, with the trachea and the bronchi and the bronchioles and then the alveoli, because I want to do it in another course in anatomy. Here's for example a picture of it. In anatomy, so the seahorse pose for first. Place the heel of standing of a wobble leg on top of the knee of a standing leg. Breathe again in and out and sink down. I'm going to go to the page where it's actually. So we had here bronchiectasis. And another course in anatomy, which I'm going to start in a moment. We're going to go over it. There's not much to say, but I want to have at least what we have sorted down. And what was written here. The lung resembles a tree, of which the yellow trachea is the trunk. So there's the trachea. And then this trunk divides into the branches of the main bronchi, which in turn subdivide into the twig-like bronchioles. These continue to branch, and we're changing the leg. These continue to branch until they enter in clusters of minute air sacs called alveoli, which give up oxygen to tiny blood vessels that absorb carbon dioxide from them. And that was the exercise, and we're closing with the trunk igniter. Legs wide apart, we're breathing in, going down. And breathe again out. Again in. Out. And the last round, breathe in. And out. And now we've uncrossed the legs. And out. That was the stretching. I thank you very much, and until next time.